Howdy, my name is Lois Wampler and we are Team Urine Good Hands. Today we would like to discuss how we created an innovative assistive urology drainage device for Becton Dickinson. Imagine you have just gone through abdominal surgery. You are lying in bed believing you are on your way to recovery. However, due to stagnant urine in your Foley catheter, you are slowly developing a catheter-associated urinary tract infection, or CAUTI, like 450,000 patients per year. The current Foley catheter design is prone to non-homogeneous pressure gradients as a result of dependent loop formation, airlocks, and tube kinking. These irregular pressure gradients can stagnate urine within the line, decreasing urine output measurement accuracy and increasing the likelihood of CAUTIs. Currently, infections are avoided with hourly nurse interactions to manually propagate stagnant fluids in a procedure colloquially known as a Foley salute. However, nurses could utilize this time to perform other actions necessary to patient care. Furthermore, residual urine should be cleared more frequently than hourly. Thus, there is a need for an assistive drainage urological device to effectively drain urine from Foley catheters to prevent infections and improve the accuracy of urine output measurements. An assistive drainage device of this type can prevent infections for the 13,000 people who die annually from CAUTIs. In terms of financial impact, this device can reduce the $758 per CAUTI that hospitals pay, decreasing the annual sum of $340 million. Furthermore, the current solution market is scarce, with only two similar types of devices: the Accurine Active Drainline Clearance by Medline, currently in the experimental phase, and a device designed by Sienna Colorado Solutions LLC, which is purely conceptual at this time. As Team Urine Good Hands, we are solving CAUTIs by developing a device to automatically drain urine from the Foley catheter every 15 minutes. Our product will decrease CAUTI rates, giving nurses their time back, reducing the average cost of healthcare, and improving patient outcomes. In expanding the line of BD urology products, we will penetrate further into the urological market by addressing a previously unmet and highly desirable need. To answer our user needs, which are specifically outlined in the supporting documents, our team developed three initial designs: the balloon-assisted drainage, the sleeve-covered design, and the peristaltic pump device. As shown in the bottom left corner, our first concept is centered around a pneumatic balloon and passive valve. While the valve is closed, urine will naturally pass as previously has occurred. However, when the motor activates, the balloon is compressed, opening the valve to prevent retrograde flow towards the bladder. This impulse of air rapidly increases the pressure in the Foley catheter, which will expel the stagnant urine into the collection bag. When the motor deactivates, the balloon passively refills and the valve naturally closes. The primary benefits of this device are the low cost and simplicity that will allow for an open failure, while the passive valve, which naturally remains closed, allows urine to pass through naturally. One major risk is the breach of sterility, as the Foley line will need to be punctured. Our second design is based on a peristaltic pump, as shown in the middle of the screen. Essentially, the pump would be held within a small device which clamps onto the catheter line. The device would have a sensor, potentially based on pressure, which would sense if there is stagnant urine in the line and trigger the pump to turn on. However, a major downfall of this device is that it would be very difficult to cause it to fail with the catheter line open, so that the urine would still drain with gravity if our device fails. Our third design is based on the cloth sheets that surround the Foley catheter line. The inside sleeves will be a series of rings with variable lengths, semi-rigid wiring that is mechanically controlled between them. The length of wiring will be mechanically altered, to in turn forcing a wave of the Foley catheter to propagate from the side closest to the bladder to the side nearest the collection bag. The advantage of this device is that it is able to cause urine to flow from any place on a device system. However, it may cause discomfort to the patients and cost a lot for the materials. Based on the user needs, we assessed many of our designs by using a Pugh matrix, which can be summarized with our top three design criteria. First, the design needed to fail open, meaning that if the design failed, the catheter line would remain open. Second, the design must mitigate dependent loops to reduce the volume of stagnant urine in the catheter line. Lastly, we wanted to minimize CAUTI risk. Upon evaluation, we selected the bellows ball check design, a variation of the balloon-assisted drainage device, utilizing an air bellows rather than a balloon. With much of our conceptual design finished, we were ready to create our first prototype for the bellows ball check design. As you can see here, there's a flapper valve on top, followed by a bellows and some valves and a T-valve. For the initial testing, for proof of concept, we used the prototype's compression ability with different levels of dependent loops. Water was placed into the drainage tube to stimulate urine, and the bellows was manually compressed within 1 to 4 seconds. The results demonstrated that compression of the bellows within 4 seconds produced enough pressure to propel the water with maximum 5 milliliters residual urine. This helped confirm that the general idea of the design was sufficient and something we could approve on. From the initial prototype, we have made some improvements. We incorporated a motor and a computer-driven system, transitioned to a removable device to facilitate MRI compatibility, instigated pressure-driven valves, and decreased drainage line invasion. The motor helps automate the process by providing the mechanical pressure to push sterile air through the tubing. Computerization via Arduino allows the timely clearing of the line. The pressure-driven valves ensure less invasion of urine into the wrong places of the system. Finally, we hope to have the final product be made mostly from lightweight polymer as it is affordable. Among the risks of the bellows ball check prototype design, we have recognized 2 critical features that we must address in order to reduce the risk of our devices: the bellows and the valves. Since the valves directly control the direction of the urine and indirectly air pressure, we chose to have ball check valves as one of our check valves, since it will undergo less erosion than other valve designs such as piston or swing check valves. Secondly, the bellows and motor system is to provide the necessary power and pressure to drive urine to the drainage bag. However, manufacturing errors to the motor and/or bellows could, although unlikely to happen, could cause large problems with our design. Therefore, we plan to implement standard quality control procedures and manufacturing to effectively mitigate this risk. Here you can see an animation of the final device. In this design, a bellows is encased in a shell that allows a screw motor to be mounted and drive compression. When activated, the motor will rotate the internal screw, propelling the compressor nut, seen in white, downwards, and thereby compressing the black rubber bellows. When expelled from the bellows, air will flow into the T-valve main line. The proximal connector, that being towards the bladder, will have an integrated ball check valve. This check valve will allow the passive drainage of fluids when the motor is not engaged. When the bellows ejects air, the ball check valve will prevent back pressure from reaching the bladder and ensure fluids move distally towards the collection bag. The motor will then reverse, causing the valves to reverse, sealing the bellows component, and allowing the bellows to draw in sterile air through the vented compartments in the shell and subsequently through the one-way flapper valve housed inside the white compressor. Although faced with unfortunate and historical circumstances during this time, we as a team have developed a device that will mitigate the risk of CAUTIs. Future work to improve this device should focus on verification and validation benchtop tests, such as a back pressure generation test, finite element analysis, and fluid flow testing. Additionally, prototyping should continue and a sterilization procedure should be finalized. As a team, we would like to thank you for your time and attention and assure you that if the future of urology rests in our hands, that you're in good hands.